250,000 people per year die due to illness. Heart disease being the #1 killer, causing a death every 33 seconds, and cancer causing a death every 56 seconds.
Alright, so sure that this plan will cost some money, but there is no price that you can put on the lives of Americans to make the healthcare be better for the entire United States.
So with affordable healthcare, these statistics that I just told y'all should significantly decrease. Healthcare should be affordable for everyone in the world, no matter like what your race, religion, or economic standing is. With affordable healthcare, families will feel safer, knowing that they will have the opportunity to receive medical treatment. And with this, we can say healthcare is the maintenance and improvement of physical and mental health of individuals.
Now, healthcare, this entire healthcare system will be a completely new system that will make it affordable to everyone.
Time.
Okay, 1 minute to respond to the question.
Okay, you say that there is no price for health, but there is. For the Affordable Care Act, what you pay for your insurance, you only get the care that you pay for. So if you only have not much money to get your insurance, you only get what you pay, and if whatever else you may need comes straight out of your pocket. And health insurance in America is very expensive.
30 seconds.
And people don't have enough money to be paying out of pocket for the things that their insurance aren't covering. A lot of insurance, like, you're only getting that amount. Not because you don't have money, just because that's only what you can afford. But, onto the argument. Now, the Affordable Care Act has taken effect for the past few years now, and people still don't know really what it is. But the time has come where people are having to sign up for it, and if you don't sign up for it, you get a penalty. So people are signing up for it, they don't know what it is, and they don't know the consequences. And the government is taking away our freedom to choose what we want to do with ourselves. They're taking away how we take care of ourselves. I mean, yes, healthcare is good, but why force us into it if we're perfectly healthy? A lot of people who already have healthcare are having their plans closed because most of the requirements are not met. So,
Okay, all right, 1 minute to respond.
Okay, so going back to what Ashley said at the end, she said, why change something while we are all perfectly healthy? Now, that is wrong, I'm going to tell you. Because people who cannot afford healthcare, they will not receive it, therefore they will not become healthy if they are sick, and they will not get better.
They won't stay healthy either.
30 seconds.
Alright, now according to the Census Bureau, over 15.4% of Americans were uninsured in 2011. That is approximately 48.6 million uninsured American people.
And going off what he said a little bit, with the money you make and the amount you have to worry about with this new Healthcare Act, once again, families will feel much safer knowing that they will have the opportunity to receive needed treatment more so
Time.
than they do.
All right, 1 minute to respond.
keep on misinterpreting myself. I never said that all people are healthy. I said that if there's no need for it, then why force people into it?
I got that from the site. Zeus and flowers.
Time, 6 seconds. Time, okay, that means Pro, you have 2 more minutes to build your argument, and go.
So, like my buddy right here stated, in 2011, over 15.4 of Americans were uninsured in 11. This being about 48.6 million uninsured American people. So, about 20% of these people have had problems paying their medical bills. 26% of the people have paid their medical bills over the past, 26% of people have to pay their medical bills off over a period of time. 11% are not able to pay their medical bills off at all.
Okay, so with that being said, since all those people who will not be able to pay off their medical bills, that will hurt us as an economy and will utterly destroy what healthcare stands for, which means to make us better. With that being said, this affordable healthcare will make it so that 11% can pay off those bills, and they will be able to have healthcare for little Jimmy or little Johnny who have leukemia and need treatment.
So with something like that, you can't put a price on healthcare, no matter how much it costs or how cheap it is.
30 seconds.
But also those with adults find it inadequate when they get seriously ill. So why are we making this healthcare affordable, as you say, if it wasn't doing its job before? Like,
30 seconds.
if people were ill before and they had insurance, how is this affordable healthcare going to help if it didn't help before?
Seconds.
Time, 1 minute to respond.
Okay, so this act will help people and make them healthy, such as people with cancer, etc., like that. Health insurance now, there's just simply people who cannot afford for their kids / husbands / soldiers who go out and fight, who get cancer and cannot afford it. And with this act, they will be able to. So, with that all being said,
There's a lot more positives and negatives to it. And going off him, another thing, the United States is one of the few, if not the only, developed nation in the world that does not guarantee health coverage for its citizens. Does that tell you anything?
Time, okay. All right, Colin, 2 minutes, build your argument.
Alright, imagine this. You're a high school dropout who has incurable cancer and bills are adding up. This man is not wealthy, but works has a good healthy care policy that covers the majority of his expenses. Currently, his treatment costs $35,000 and only has to pay $4,500 to stay alive. He's covering his costs right now, but as of January 1st, 2014, he must change his policies to Obamacare. Under the affordable health care, he is now responsible for $21,000 increase, which will be a next to an impossible expense to cover. The question on his mind is, how will I do this and stay alive?
Going back to what I said earlier about how people are losing the insurance they already have because it's not meeting the requirements.
45 seconds.
Well, some of the requirements are kind of useless to certain people, like rehab and newborn care. What if you never plan on having kids or injure yourself bad enough to need rehab? You're paying for absolutely nothing.
30 seconds.
One thing that has been nagging me since you said it is about the cancer. Like, the Affordable Care Act, I didn't realize it cured cancer. I didn't realize it found a cure for cancer. But we have, you keep on saying it's going to help cancer. People are still going to die, even with this act. What is it doing? Just helping you pay?
Time.
Okay, 1 minute to respond.
Okay, sort of lost my train of thought. Going back to you said that the kid, high school, dropped out. I believe you write your own path. If you drop out, you drop out. You're gonna write your life, write your story. The harder you work, the more money you're gonna make, hopefully. So, with all the money problems you're talking to him about, or making up story, whatever it
30
is,
seconds.
write your path. How you pay for it's your own doing.
Alright, now what Ashley said, I did not say that it would cure cancer. I said that it would help you to get better. And with this act, obviously, it will help you be able to pay for the care that is needed and the treatment that is needed. Now, cancer is a everlasting battle that
Time.
Okay, 1 minute to respond.
Alright, so back to the high school dropout, you're focusing on the wrong thing. He has a good job. He has it, and he had a good policy, but since the Affordable Care Act came into place, he has to take control of that, and he gets a $21,000 increase because of it. So,
30 seconds.
it's not as affordable as it should be.
Twenty seconds. Time.
Okay, all right, 2 minutes for pro to build their argument.
Okay. So, health insurance companies now hammer down on senior citizens the most. Your grandparents and your great uncles and your great grandmas, etc. They have a very hard time getting health insurance because most health insurance companies think that they will pay out more than the elderly insured person will input. Basically, what that is saying is that they will be more of a liability to the company than making them money. In addition, the elderly are dealt quote-unquote double whammy when trying to get health insurance, and that is not okay.
So, as a country, we need to grow as a country and enjoy our time we have together, but unfortunately, like he said, the senior citizens feel the effects
1 minute.
of not having the affordable health care. And once again, they get bullied all the time by health insurance companies, and these insurance companies know that the elderly are more likely, obviously, to become ill due to age or sickness or get injured or hurt. Therefore, their health insurance prices do become ridiculously high. And they do, because of that, they do have a hard time getting
30
your health
seconds.
insurance because the insurance companies think